1. What is the best definition of behavior in applied behavior analysis ABA? A. An internal process that cannot be measured. B. A private mental event. C. Any observable and measurable action of a living organism. D. A feeling or thought. 2. Which of the following is an example of negative reinforcement? A. A child receives praise for finishing homework. B. A teenager avoids detention by arriving to class on time. C. A student receives candy for raising their hand. D. A worker earns a bonus for meeting a goal. 3. What is a discriminative stimulus SD? A. A consequence that weakens behavior. B. A stimulus that signals reinforcement is available. C. A reinforcer that occurs randomly. D. A stimulus associated with punishment. 4. What is the primary function of a functional behavior assessment FBA? A. To diagnose psychological disorders. B. To collect academic performance data. C. To identify the purpose a behavior serves. D. To administer reinforcement. 5. What is the main difference between continuous and discontinuous measurement? A. One measures behavior duration, the other does not. B. One measures all responses, the other only some. C. One uses graphs, the other uses interviews. D. One is based on preference, the other is not. 6. Which experimental design best demonstrates a functional relation? A. Multiple baseline design. B. Descriptive analysis. C. Scatterplot analysis. D. Anecdotal observation. 7. What is the function of reinforcement in behavior change? A. To decrease behavior frequency. B. To punish undesirable actions. C. To increase the future occurrence of behavior. D. To delay behavior occurrence. 8. Which of the following is a conditioned reinforcer? A. Food. B. Water. C. Money. D. Sleep. 9. Which term describes presenting a stimulus following a behavior that decreases its future occurrence? A. Positive punishment. B. Negative reinforcement. C. Positive reinforcement. D. Extinction. 10. What is stimulus generalization? A. Responding only to one specific stimulus. B. A decrease in behavior across settings. C. Responding similarly to different but related stimuli. D. Teaching only in the natural environment. 11. What is a motivating operation? A. A reinforcer that has been paired with another. B. An antecedent event that alters the value of a consequence. C. A punishment that occurs naturally. D. A discriminative stimulus with no function. 12. What is extinction in ABA? A. Withdrawing reinforcement to reduce behavior. B. Physically preventing a behavior. C. Punishing a response. D. Ignoring all behavior. 13. What is response generalization? A. Emitting different responses to the same stimulus. B. Not responding to any stimulus. C. Responding the same way in all environments. D. Emitting a target behavior only in training. 14. Which is the most appropriate method for teaching a complex skill in ABA? A. free shaping. B. Chaining. C. Prompt fading. D. Punishment. 15. What is the ethical requirement when using punishment procedures? A. Avoid using reinforcement. B. Use punishment as a first strategy. C. Always obtain informed consent and use the least restrictive procedures. D. Use intense punishment to ensure effectiveness. 16. What is the best definition of operational definition? A. A broad description of behavior. B. A personal interpretation of behavior. C. A clear, observable, and measurable description of behavior. D. A summary of behavioral outcomes. 17. Which of the following is a permanent product measurement? A. Counting worksheets completed. B. Measuring response latency. C. Observing a tantrum. D. Recording time on task. 18. What is the role of a behavior analyst in maintaining client dignity? A. Ensuring data collection is consistent. B. Following research protocols. C. Promoting client independence, choice, and respect. D. Avoiding ethical responsibilities. 19. What is Inter-Observer Agreement IOA used for? A. To create behavior plans. B. To increase generalization. C. To ensure reliability in measurement. D. To determine reinforcement effectiveness. 20. What is shaping? A. Delivering reinforcement on a fixed schedule. B. Teaching in massed trials. C. Reinforcing successive approximations of a behavior. D. Prompting and fading simultaneously. 21. When should a behavior analyst update a client's behavior intervention plan? A. Only at the end of a school year. B. Whenever data indicate it's necessary. C. Annually. D. Only if the parent requests it. 22. What is the first step in conducting a preference assessment? A. Measuring behavior duration. B. Presenting items randomly. C. Identifying potential reinforcers. D. Collecting ABC data. 23. What is task analysis? A. A method for fading reinforcement. B. A process for identifying reinforcement. C. Breaking down complex skills into teachable steps. D. A punishment procedure. 24. Which of the following is a variable interval reinforcement schedule? A. Reinforcement every 5 minutes. B. Reinforcement at unpredictable time intervals. C. Reinforcement every 5 responses. D. Reinforcement after each correct response. 25. What is behavioral momentum? A. A decrease in behavior under punishment. B. A motivational state. C. The increased likelihood of a behavior due to a series of high-probability responses. D. Response generalization. Behavior Analyst Certification Board. The Behavior Analyst Certification Board BACB test is a standardized examination used to certify professionals in the field of behavior analysis. It assesses the knowledge and competencies required to become a board-certified behavior analyst BCBA or a board-certified assistant behavior analyst BCABA. The test covers key domains such as behavior assessment, intervention strategies, measurement and data analysis, ethical compliance, and professional conduct. It is grounded in the principles of applied behavior analysis (ABA) and ensures that certified individuals can design, implement, and evaluate effective behavior change programs. The exam is administered globally and is a requirement for credentialing by the BACB, helping ensure quality services for individuals with behavioral needs. Here are the top 5 beneficial uses of the sample exam. 1. Professional credentialing. Passing the BACB test grants certification BCba or bcaba, formally recognizing an individual's competence in applied behavior analysis, a crucial step for career advancement and credibility. 2. Employment qualification. Certification is often a mandatory requirement for behavior analyst positions in schools, clinics, hospitals, and private practices, making the test essential for job eligibility. 3. Assurance of ethical practice. The exam ensures certified professionals have a firm grasp of ethical and professional standards, promoting safe, effective, and respectful behavioral interventions. 4. Global recognition. The BACB certification is internationally respected, enabling professionals to work across borders and in diverse cultural and clinical settings. 5. Improved client outcomes. Certified analysts are trained to implement evidence-based interventions, leading to better behavioral progress and quality of life for clients with developmental and behavioral disorders.